Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. This is Dr. Waqar from Child Health Matters. So today I will talk about secrets of MRCPCH clinical exam, how to pass MRCPCH clinical exam. Many doctors, they are very intelligent and very good doctors in clinical side as well as the theory side, but unfortunately when they are going to appear in the exam, they don't pass the exam, they fail the exam. So what are the reasons of failure? And I will tell you the surprising fact before I am going to tell you further about how many stations are there, what are the pass marks, and what are the books you should refer, how to approach in the exam. So this is all introduction. So surprising fact, when I saw these things, so I surprised. If you will see here on your left side of your screen, in the red box there are overseas doctors percentage, and in the blue box the doctors who are working in the UK. So this is a theory exam. On your right side, the percentage of the MRCPCH theory exam, which is theory and science. Almost all theory exam have the same similar percentage. So if you will compare, if you will go in the theory exam, if you will see, this is 2023 diet 1, diet 2 and diet 3. So these are the 80.7 percentage of overseas doctors who are pass the exam as compared to the UK doctors, which is 63.6 only. So in diet 2 and diet 3, you will see the same differences almost. Overseas doctors has the good passing percentage as compared to the UK doctors in theory exam. But when you will come to the clinical side, this would be the sudden drop. It's a lot sudden drop of overseas doctors percentage. They cannot pass the exam. So what are the reasons? If you will see here, 52.5 of overseas doctors, and UK doctors passing percentage in clinical is 70.6. So these three diets of 2023, if you will see here in the last diet, it is 50.6 only, and as compared, your UK doctors who are working in the UK, it's 71.1 of passing percentage. So what is the reason? When the theory exam comes, the overseas doctors are very good in theory side, but when it comes to the clinical side, their passing ratio is sudden drop, it's a dip. So what is the reason behind it? So as you know, this exam is expressive exam. This is not exam of total 100% knowledge. So if you have a good knowledge, even though you know memorize the page by page, you are very good in clinical side as well, but if you don't understand the how to pass the exam, how to approach in the exam, and you have only few minutes. So for example, in the clinical side you have 3 minutes. In during 3 minutes with the examiner, 6 minutes you will perform the exam and 3 minutes with the examiner. So in these 3 minutes, if you will tell the examiner for all the page of your knowledge, definitely you don't have time to reach to the management side, the complication, what advice you will give to the parents. So every step, every question has the marks. So these are the some tricks, and there are some facts which you should know before you are going to appear in the clinical exam. So let's talk about the total marks and what are the passing marks and how many stations are there. So before I'm going to start this, please subscribe my channel for further videos. So total you have 6 attempts after you have passed the MRCPCH theory exams, all three parts, FOP, TOS and AKP. And total number in clinical stations are 10. Until 2024 it is the same. Maybe in future they will change, I don't know, but total number of stations in MRCPCH clinical exams are 10 stations. I will tell you each and every station. Each station has the different marking, and total marks are 82 marks in the exam, and passing marks are the 62, which is around 76.8 percentage. So total marks are 82, pass marks are 62, which is 76.8 percentage of passing percentage in the MRCPCH clinical exam. So 76.8, not the 78, which is 76.8 is the pass marks in the clinical exam. So if you will get the less than 52 marks, you have to differ from the next diet. They will not allow you to appear in the next diet. You have to miss one skip is there. So you have to one skip for the preparation purpose. If you have less than 52 marks, definitely you need more preparation, and they advise you to prepare more. You take maybe 6 months or 7 months or 8 months for preparation. That's why they will not allow you to sit in the next diet in the same year. So MRCPCH clinical exam, they have their total 10 stations, and total marks, as I told you, pass marks are 62. So one station is the history station, other is the development station, two video stations are there, and two communication stations, and four clinical stations. Four clinical stations has 32 marks, so they are very important. So in one history you have the 10 marks, and development station you have 12 marks, and each video station has the 6 marks. So it is two video stations, you have total 12 marks, and communication station has, each station has the 8 marks, and total marks are 16. So two communication stations and four clinical stations. So in clinical stations there are total 32 marks. Each station station contains of 8 marks. So clinical side, if sometimes what happen, if you will have a very bad clinical station, sometimes you will get candidates are getting 1 mark. So even this one station can decide of your pass and fail. So if you will get the 1 mark in any station, then definitely you are at risk of passing or fail. Because if you are good in the history, in the development side, in the video station, communication, if you will get all these full marks, so if you will drop one station here, even though you are on the safe side. But if you have, definitely you might not go 100% in these. Candidates are there, they perform 100% in these all stations, communication, video, development, the history, and then even though they will get the less marks in the clinical side, they will get through, they will pass the exam. So if you are good to understand, you have to understand all these stations and how to approach of these stations. So this is the communication book you should refer. You have the communication stations, as you know, breaking bad news, information giving, consent, education. So all these scenarios you will find in this book that is called the Rebecca book, and maybe you will find the new edition. So this is the master parts and communication in communication skill. How would you approach? How would you study from this book? You will not find very detailed information in this book, but you will find just overview and what question a role player may ask. So if any topic you will go through in this book, that topic definitely you should, in communication station you should take care of the jargons. You will not, you suppose not to be use of medical terminology with the attendant. If it is medical student for the education purpose, yes, you may use. But if it is non-medical person, layman person or mother or father, you cannot use the medical terminology, which we call it jargon. So if you will use the jargons, you might lose the marks. So how to know that this is the jargon or not? So there are two websites, one is NHS and other is patient info. These are the good websites. If you will write the topic, and at the end if you will write the NHS, any kind of topic you will write, for example you are writing Huntington disease or you are writing meningitis, anything, that websites will give the patient's information for the patients and caregivers. So you will find the good knowledge, good wordings from these websites, patient info and the NHS. Just write the topic, at the end you write the NHS, or at the end you write patient info. You will find the good knowledge from these websites for the purpose of communication station. The other book, as you know, you have to refer this MRCPCH clinical shortcase in history taking and communication skills, which we call it the Mark BT, and this is the 4th edition. Maybe there is a new edition is there. I am not aware of it. So this book is very good. You have to go through this book before you are going to appear in the exam. And from this book, definitely many doctors, they have the specialty in from their own countries. They are already very good in the clinical side, and their knowledge is good. But this book will give you the approach. This will give you the differential diagnosis in the clinical side. This will give you the history, proper history, and also there are communication topics in this book and developmental side. So this will give you the specific things. For example, you are going to appear in the exam, clinical exam, and you have the case of cystic fibrosis. Definitely there is a lot of things you should have to tell, but you have only 3 minutes. So you should have to tell the specific things regarding the cystic fibrosis, what examiner wants to know from you. So definitely there are complications, there is a management. You cannot finish it 2 minutes. Total 3 minutes you have. 1 minute or less than 1 minute, you will just explain the positive findings. Just describe your positive findings to the examiner. Your 1 minute will gone. So now you have remaining 2 minutes. In remaining 2 minutes, you have to tell about the admission. You have to tell about the management side, investigation, examination, and the complications, and also what advice you should give. So specific things you will find in this book, how to approach in the clinical exam. Yeah, so this is a very good picture. Every doctor, every candidate who are going to appear in MRCPCH clinical exam, their destination, their finish point is the same. So they want to pass the MRCPCH exam, right? So definitely it's a long journey, and you might have started a year before or 2 years before, or 3 years before. So MRCP, so this is your final point destination. You have to reach it. Now there are two types of doctor. Now already you have passed the theory exam. Now the clinical side, as I told you, the overseas doctors which are lacking, I think the major reason is the drop of the percentage of pass percentage in clinical side, of MRCPCH is expression. Many doctors, they don't understand the exam, and definitely when they are, you have two ways to get the experience. One, either you go to the exam and you fail, you learn from your mistakes, and then you appear the next time. Or you should have to appear in the good course. You should choose your mentor to a teacher. You should go for the course. They will definitely guide you properly and appropriate steps, and you may have passed in the first attempt. So there are two types of doctors. One, who, if you are not going to appear in the course, you are going to the exam, you will get the experience from your failure. Then you might will take a lot of time. Definitely you will ask from many doctors who have already passed. Everyone is giving you their own experience. But one thing I am telling everyone, for example, if you are asking a doctor whose clinical side is very good, or for example whose theory side is very good, who is good in communication, who is good in history taking, and those doctors has failed because of they are weak in clinical, or they are weak in development. So those doctors are failed. So definitely these doctors will tell you their own experience. Just focus on the development. It's very difficult. You should have to memorize the things. Maybe you are good in the development, and the other thing he will tell you, clinical is okay, it's very easy, communication is very easy, don't worry about it. So maybe it's difficult for you. So whenever you are getting any information from anyone who has passed the exam, just think about one thing. I'm telling everyone, you should think about yourself. Where do you stand? So everyone has some weakness and some strong points. So some is what are your strong points? Maybe others are weak in that points. Maybe you are weak in that points, others are strong in those points. So you should aware of it. Where do you stand? So you should know about yourself. Okay, then if someone is taking course, definitely they might choose the right things, and they will prepare well at the appropriate exam approach. They will not go here and there, and there are good chance that they might pass in the first attempt. So it's up to you. Either you will learn from your mistakes, because it spends a lot of money, a lot of stress, a lot of time to appear in the clinical exam. So definitely if you will pass in first time, it is good for you. So my advice for you to take the course of anyone to whom you like, and the course will give you a good guidance and approach and expression. This exam is totally a expression. Whatever you will read, whatever you will study, whatever you will listen, whatever you will see, these are other things. This exam is action. This exam is totally expression, and examiner will watch you when you enter in the station room in the exam, and until you left the exam they will watch your behavior, your appearance, your communication style, your way of talking, your gathering information, everything they are observing, and they have the tick of the checklist to make it check that you clear this thing, you clear this thing. Okay, so I'm going to conducting a courses of clinical course and the mock exam. Mock exam is really good for the candidates who are going to appear in the exam. They have near exam, it's very good for them, it will be helpful, and it will take your definitely it will give you the good skill. And maybe the majority of reasons of failure are stress at the exam, stress inside the exam. Many candidates, they are very good, but during stress of the exam they are unable to give their full performance. So to release this stress, this mock exam is very good. Okay, the clinical courses I am conducting all stations, and if you want the all complete thorough course, it's up to you. If you want for example, you are weak in the clinical side, you want only clinical, if you want development, if you want history, I have also the courses which are separate, and the two complete all together courses. If you need any kind of help, and if you want to appear in my course, you can email me on my Gmail, so that we can arrange a seat for you, to book a course for you. Thank you very much.